Hello and welcome. Today we're diving into a fascinating and sometimes challenging topic: pancreatic pseudocysts. We'll explore what they are, how they form, and what can be done about them. So, buckle up as we unravel the mysteries of these fluid-filled collections near the pancreas. Now, let's talk about what causes these pseudocysts to form. The most common culprit is acute or chronic pancreatitis. This inflammation of the pancreas can damage the pancreatic ducts, leading to leakage of pancreatic enzymes and fluids. Trauma to the abdomen, such as from a car accident, and even certain surgical procedures can also disrupt the pancreas and trigger pseudocyst formation. Less frequently, they can be associated with pancreatic tumors. To understand pseudocysts, we need to peek into their inner workings. Following pancreatic injury, leaked enzymes and fluids trigger an inflammatory response. This inflammation walls off the fluid collection, creating a pseudocyst because the wall isn't lined with epithelial cells like a true cyst. The wall consists of fibrous and granulation tissue. The fluid within often contains pancreatic enzymes, blood, and inflammatory debris. The size and location of the pseudocyst can then impact surrounding organs. In terms of who gets these pseudocysts, they are most common in adults between the ages of 30 and 60. Individuals with a history of alcohol abuse or gallstone disease, both major causes of pancreatitis, are at a higher risk. While precise numbers vary, studies estimate that pancreatic pseudocysts develop in up to 10% of patients with acute pancreatitis, and a higher percentage in those with chronic pancreatitis. What are the signs that you might have a pancreatic pseudocyst? Many individuals experience abdominal pain, often persistent and located in the upper abdomen. Nausea, vomiting, and loss of appetite are also common. In some cases, a palpable mass can be felt in the abdomen. If the pseudocyst compresses nearby structures, it can lead to complications like jaundice if it presses on the bile duct, or gastric outlet obstruction if it presses on the stomach. In rarer, more severe cases, the pseudocyst can become infected, causing fever and sepsis, or even rupture, leading to peritonitis. Diagnosing a pancreatic pseudocyst typically involves a combination of imaging studies. A CT scan of the abdomen is usually the first line of investigation, providing detailed images of the pancreas and surrounding structures. MRI can provide even more detail and is useful for characterizing the pseudocyst's contents. Endoscopic ultrasound, or EUS, is another valuable tool. It allows doctors to visualize the pancreas and the pseudocyst with high resolution and even obtain a fluid sample for analysis to rule out malignancy or infection. While there aren't distinct types of pancreatic pseudocysts based on pathology, they are often classified based on their location in relation to the pancreas, their size, and whether they are associated with acute or chronic pancreatitis. Some may be small and resolve on their own, while others can grow quite large and require intervention. Also, they can be single or multiple. Complicated pseudocysts that are infected, bleeding, or compressing surrounding structures will also be classified as such due to increased urgency for treatment. The approach to treating a pancreatic pseudocyst depends on its size, location, symptoms, and whether it's causing complications. Small, asymptomatic pseudocysts may be monitored with periodic imaging, as they can sometimes resolve spontaneously. Larger, symptomatic pseudocysts, or those that are infected or causing complications, often require intervention. Drainage procedures include endoscopic drainage, where a stent is placed through the stomach or duodenum into the pseudocyst, surgical drainage, which may involve creating a connection between the pseudocyst and the stomach or small intestine, and percutaneous drainage, where a needle is inserted through the skin to drain the fluid. The chosen approach depends on the individual case and the expertise available. Preventing pancreatic pseudocysts primarily focuses on preventing pancreatitis itself. This includes avoiding excessive alcohol consumption, managing gallstone disease, and maintaining a healthy lifestyle. For individuals with chronic pancreatitis, adherence to prescribed medications, dietary modifications, and lifestyle changes can help minimize the risk of pseudocyst formation. The prognosis for pancreatic pseudocysts is generally good, especially with appropriate management. Many small pseudocysts resolve spontaneously. For those requiring intervention, drainage procedures are often successful. However, there is a risk of recurrence. Recent research focuses on improving endoscopic drainage techniques and developing less invasive approaches. Studies are also exploring factors that predict pseudocyst resolution and identifying individuals at higher risk of complications. Ultimately, early diagnosis and appropriate management are key to a favorable outcome.